Hello Year 10, Miss Rowe here. This is P2. Nice and easy. So we're talking about understanding job roles of health and social care practitioners, or otherwise known as Learning Outcome 2. Describe one health and social care job role held within each of the services identified in P1. So that includes statutory, private and voluntary. So, job roles. So, nice and easy. Social worker, they're usually statutory because social workers are normally employed by the local authority or the council. They help clients find solutions to their problems, and an important role is to build good relationships with the client so they can work together to make changes to improve the situation they're currently in. So social workers obviously work with many individuals, including older people, people with learning disabilities, physical disabilities and mental health conditions such as depression, anxiety, schizophrenia and personality disorders, families at risk of breaking down, foster carers and adopters, and children who are at risk of abuse. So that is an example of a statutory position. Okay. Some of the other roles is nurse, which help perform a wide range of clinical and healthcare tasks in many different types of settings. So they work in hospitals, nursing homes, GP surgeries and in the community. So you might have heard of like a community nurse or a community psychiatric nurse or mental health nurse, and they go visiting people's homes. So that is an example of the different types of nurses. So you've got the general nurse, intensive care nurse, midwife, school nurse, elderly care nurse, GP practice nurse, health visitor, district nurse, mental health nurse and a children's nurse. So they normally want a university degree in nursing, and you need to be registered with the NMC, which is the Nursing and Midwifery Council. So some of the other skills that are needed by health and social care practitioners are English skills, numeracy skills, communication skills, personal skills, professional attributes, so carrying out duties, responsibilities correctly, following policies and procedures, being responsible and reliable. Digital skills, you have to put the notes and records and reports normally on a hospital system nowadays. You need to be able to use monitoring systems to see how that patient or the individual is doing. Teamwork and problem solving skills. So you have to work with other services and organisations. So you just need to be able to prioritise workload and demonstrate problem solving skills. And then we can talk about different job roles again. So we've gone over the nurse. So obviously nurse can be statutory, it can be private, and she can be, or he can be, voluntary as well. So doctors are obviously highly qualified medical practitioners, so they can examine patients, diagnose illnesses and disease, and prescribe and carry out treatments too. So they are normally based in a hospital or they work in the community. So it completely depends on where they are working. They could work in statutory by working in Blackpool Victoria Hospital, or they could work in private working in Bupa or Spire. So I think it all depends where that person, whether they're a nurse, doctor, HCA, whatever, it doesn't matter as long as you can differentiate where statutory is, where private is and where voluntary is. HCA or healthcare assistant normally help with day-to-day care of patients within hospitals, care homes, nursing homes, or obviously they're in their own home as well. They work under the guidance of the qualified Hi Year 10, so this is a video for P2, which is describe one health and social care job role held within each of the services identified in P1. So that's statutory, private and voluntary. You need a job role for each of those. So for example, social worker, they're usually statutory care workers and they're employed by the council, also known as a local authority. They help clients find solutions to their problems. So they might work with different types of individuals, such as older people, people with learning disabilities, so physical disabilities, mental health conditions such as depression, anxiety, schizophrenia, and personality disorders. They also work with families at risk of breaking down, foster carers and adopters, and children who are at risk of abuse and neglect, I should say. So that social workers are usually statutory, so that's a good one for that. When it comes to a nurse, obviously there's various nurses we can think of. They can be a general nurse, a GP practice nurse, a health visitor, a midwife, a school nurse, a community psychiatric nurse or a mental health nurse, a children's nurse or an elderly care nurse. So they're the kind of job roles within a nurse area, and they're some of the types of specialities of a nurse as well. Some might be just a general health nurse, some might be a midwife. So these are options you can put down. Doctor, highly qualified medical practitioner, so they can examine patients, diagnose illness and disease, prescribe and carry out treatments as well. So they might be based in a hospital, like Blackpool Vic, which might make them statutory, but then they also might work for someone like Bupa or Spire, and that's what makes him private. So these job roles, some of them can be statutory, private or voluntary. Social worker is normally statutory though. Healthcare assistant, so they help with day-to-day care of patients in hospital, care homes, nursing homes, or just in the home. So they work under the guidance of qualified healthcare professionals. So they normally work with nurses and work with doctors, and they will give them support. So some of the special care functions for a social care, the healthcare assistant or a HCA, as they call them in the hospital. Personal care, helping patients to shower and get dressed. Helping and supporting individuals to eat. Making beds, using equipment such as hoists to lift and move patients out of bed or into the bath, for example. Helping a patient to go to the toilet, tidying the hospital ward or the patient's home to make it tidy and make sure it's safe for them to walk around, there's nothing on the floor. Attending meetings with other healthcare professionals. And with extra training, some HCAs can change wound dressings and carry out some vaccinations too. So activities coordinator. That's a person who organises social activities for people who need care and support. So they may obviously work in various settings. So for example, they might work with groups in a residential care home or a day centre. They also work in individuals' homes or in the community. So again, this can be statutory, private or voluntary. So you choose. If you don't understand this, just have a little search online or speak to me on Monday. But this is P2, so you should be on about P5 by now. Outreach worker. So they focus on providing support for individuals in the form of advice. They give guidance as well, mainly for subjects like drug, alcohol dependency. They'll work with other drug and alcohol action groups, youth offending services, council, charitable organisations as well. So an outreach worker basically finds out about the individual and what's happening with their situation and what needs to be met. So they talk about different types of options and how to get it. It might involve going out with police patrols, helping with needle exchange services, so it's clean and there's no danger involved, running workshops in schools and youth centres to raise awareness. It's all about building relationships when it comes to an outreach worker. And again, it can be statutory, private, or voluntary, depending on who the company is that you're working for. Occupational therapist. They work with people to support them with independent skills for everyday tasks. So, for example, if someone has a stroke, they might need to learn new ways to do something because they might have lost use of their left arm or hand. So they'll literally work with them to maintain the independence again. Counsellor. They work for the NHS, the council, community care or charity organisations. They may also work for private businesses though, but then they have to charge a fee for that service. So for example, one leaflet I saw in the doctors the other day, I'll try and remember to bring them in on Monday just to show you a bit of a scope of what, fees are included for private. You could go on the NHS list, but it was an 8-week waiting list. Then it's a donation for that. So you could give £10, £5, whatever you can afford. However, if you wanted to see them next week, you'd have to go private, which was £45 per hour. So I did pick up a couple of leaflets anyway, so you can have a look through them and see the different types. So that is a counsellor. They can be statutory, they can work for a charity, or they can be private. Dietitian. So they specialise in nutrition. So they obviously need a good understanding of science and everything behind nutrition as well. So they usually work in the NHS, but they also work in sports nutrition, the food industry and health promotion. So dietitians educate people about nutrition and then to help them make informed and practical decisions about their food choices. So they work with people when they've got diabetes, high cholesterol, food allergies, intolerances, obesity, learning disabilities, and those with swallowing difficulties or an eating disorder. So they look after the nutritional needs of an individual. So, and they also help those individuals being cared for in intensive care units who might be unconscious as well. So hopefully you've got that on screen now. Hopefully that'll help you with P2. Should be nice and easy.